Good afternoon. My name is Nilpa Shah, and I'm the coordinator of recruitment. I welcome you all to the 12th annual UC Davis Pre-Medical and Pre-Health Professions National Conference. I would like to thank all of the student volunteers and sponsors, especially WMC, for its support. Today, I would like to introduce Dr. Renee R. Jenkins, whose contributions in the area of adolescent health and helping underserved children distinguishes her nationally. Dr. Jenkins earned her medical degree at Wayne State University School of Medicine and completed her residency at Albert Einstein College of Medicine. She is an emeritus professor in the Department of Pediatrics and Child Health at Howard University and an adjunct professor of pediatrics at George Washington University. At Howard University, she also has served as a department chair of pediatrics and became the first director of the Office of Faculty Development of the College of Medicine. Her publications and presentations range from adolescent health and sexuality to violence prevention and health issues of minority children. Dr. Jenkins has served as the president of the American Academy of Pediatrics and the Society for Adolescent Medicine, becoming the first African American to hold those positions of leadership. It is my honor today to present Dr. Renee Jenkins on the stage.
So I appreciate the stalwart people who are hanging in here when you could be at lunch. So thank you for doing that. And hopefully we'll have some more people who pick up the tape. And there hopefully will be some messages that will be useful to them. So first of all, I want to congratulate the organization that pulls us together. I know that there are students all over campus experiencing workshops as well as the keynotes in several venues, and so trying to, coalesce everyone is more than a notion. And I know that the students are very responsible for the program, so I congratulate you all on all the work you do there. And the audience, you should be congratulated for taking advantage of this kind of event early on, giving up your weekend to do this, but you can only benefit from sort of making your career decisions by having the kind of exposure that you're going to have during this meeting. And so I think you are making a good choice, and I hope that you will continue to make these choices and look for opportunities to, to pull together the many kinds of questions you have to ask yourself as you progress along in your career decisions, okay? So hopefully we'll provide some basis for you to think about some of the decisions you're going to be making about your career choices. I know that I've been told by the organizers that pediatrics is a popular specialty that people may want to go into. So we have aspiring pediatricians here. I know there's at least one, right? Other aspiring pediatricians. Okay, all right. So hopefully I'll give you some messages and some resources for you to look to in terms of thinking about your career in pediatrics. For those of you who may be listening or who are in the audience who aren't thinking about pediatrics, I also want to plant the seed for you to think about children in whatever specialty you work in, because children are where it all starts. And a number of the chronic conditions in adults we're finding really initiated during childhood. And so children are an important part of the equation. And there's one thing that I really experienced when I was president of the Academy was people don't think about children. And children is part of a plan. For example, disaster preparedness was one of the issues that came up when I was president of the Academy. And we had disaster preparedness plans from municipalities that didn't have anything about kids in those plans. They had things about pets, okay, and nothing about kids. And when you ask them, well, where's the children's part? Well, children are going to be with their parents. No, they're not. They're going to be in school, they're going to be in daycare, okay? And so thinking of children in whatever area you go into, I think is a really important element. And I'll close with hopefully a quote that will make that case for us. So let me get started. And I am so in adolescent medicine because I'm so not techie, okay? So let's see. All right. Again, my point is that children still need you no matter what specialty area that you go into. And you don't always know or have a sense of just how far you'll be able to go in your career. And so you have to, I think, remain, starting as a child, with a mind open, with your dreams and wishes really open to what you might be able to do. I can tell you there was no way that this second grader had any idea that medicine was going to be a reality for her. I actually had the benefit of having an aunt who was a pathologist. And I had no idea in second grade what a pathologist was, right? So people told me, well, she cuts on dead people. I'm like, no, my aunt's a really nice person. She wouldn't do that. So, you know, knowing kind of what the sphere of reality was relative to medical careers was not something that you even ever thought about when you were a child. And now you understand and you're finding out more what the possibilities are for career choices. Even once you decide to go into pediatrics, there are so many other specialty opportunities, primary care, that you may want to know about. Then you go into residency training if you're really fortunate, and New York was an amazing place to train. But you, again, you know, I thought I wanted to do primary care. I wanted to work in a urban clinic. I had adolescent medicine was hardly a specialty in that time. So my experience was during that adolescent medicine residency that I was able to go and work in a free clinic and really start to help kids and see the connection between the quality of life and health outcomes, okay? That all that you can do is often not about the medical care, but it's about understanding the context of a young person and how their health fits into that context. I took a young lady who was not doing well in counseling to this free clinic, and she used poetry as her escape and her way to express what some of her mental health issues were. So again, it's not always medicine or it's not always a health intervention, but there can be positive health outcomes from a number of events. Then, who was to know that part of pediatrics is advocacy? And here I'm testifying at a federal hearing, at a congressional hearing. I would have had no idea during residency that that kind of thing was ever in the cards for pediatricians. And I was doing a testimony on taking a minor across state lines being a federal offense if the minor was going to get reproductive care, specifically pregnancy termination. And I gave my testimony, and then there was a mother who was there who said her daughter had been taken across a state line for a pregnancy termination by her boyfriend's mother. And it happened over a year ago, and now her daughter has PID as a result of that. And I'm like, no, she doesn't. She's still probably having relations, and you don't know that. So you go into it, you know, giving your part of what you know as reality, but you have to recognize that congressional people often get stories about what happens that are really not based on real medical care. So if they don't hear our voice as pediatricians, our voice as health people, they're not going to be able to make the right kind of decisions about things like this law. It turned out that it did not pass, but again, it was helped by the testimony that people came that gave that were really health specialists. And then one thing that you really never expect is sometimes to really be able to represent your specialty area with a person who might be able to actually make a difference and listen to advocacy. And this was, again, around what Dr. Rios talked about, the Affordable Care Act. The president really asked for the medical people to step up, not only physicians, but nurses, physician's assistants, all of us to really get behind the Affordable Care Act. And I was able to represent the Academy to support the president in that. And as we talked about already, the Affordable Care Act, although not perfect, is certainly helping people. And I think we'll all be working a lot more in our states, particularly in trying to make the Affordable Care Act work. So I thought, okay, I'm trying to rally people around pediatrics. What are some of the positive things that you hear or know about pediatrics that ought to really inspire you, right? So these are the top 10 as recorded by a colleague, Dr. Iannelli. So what do you think are some of the top 10 reasons? Because you guys are already sold on pediatrics, right? All right, so first of all, number 10, all right? When you are in med school, you're still going to get 2 or 3 weeks off for Christmas, spring break, a nice long summer, and your college buddies will be working at their real jobs, okay? Now, what happens is it turns out now, after first year, maybe you don't have so many weeks, but at least you did have that. Number 9, show me the money. Okay, pediatricians aren't the rich guys on the block, but you still are in the top 5%. So you're still going to be able to have a very reasonable living. And I think, as our colleague in emergency medicine said, it won't be the first or second year you're out, but eventually you really will be able to buy a house and support your family, and it's a very decent life. Number 8, when you get to work with kids who are most often than not, they get better, okay? My husband says to me, he's not a physician, but he's worked in the health area. He said, pediatricians are working with nature, okay? A lot of doctors who take care of older, they're working against nature, but you guys are working with nature, so your kids are generally going to get better. Even if your patients are younger, number 7, infants that cry a lot, you don't have to worry because you're not going to have to listen to them all day. So, on the other hand, you can also choose adolescent medicine, where the people aren't crying all the time, okay, which is what I did. I wasn't very good at tolerating the crying. Number 6, by the time you graduate from medical school, finish your residency, and start practicing, they'll likely have medical liability and health insurance mess fixed, and health insurance mess is on its way, okay? And at least it ought to be fixed by the time you retire, okay? All right, where do we go? To number 5, moms and dads are easier to deal with as parents than they are as patients. And I'm not 100% sure about that, but that's what Dr. Iannelli thinks, all right? Number 4, I think this is a really important one. The majority of pediatricians, 81.5%, are either very satisfied or satisfied with their professional hours, income, skills, interest level, job satisfaction, and they wouldn't find in many other careers. So the pediatricians are really in that top 5 sets of people in terms of the physicians who really are satisfied with the jobs that they've selected. I cannot think of a specialty area I would rather work in than in pediatrics. I think when you come to near the end of your career, you ought to be able to say that. You shouldn't be thinking, well, I really wish I had chosen, obstetrics, or I really wish I had chosen family practice. Of the tension I often hear in medical students, it's around family practice and pediatrics. They really want to do primary care, and they like children, but they also want to look at children in the context of families. And so it turns out that when you look at the family practitioner level of career satisfaction, it's not as high as pediatrics. So we're still the guys that are the ones smiling on block, okay? All right. Number 3, pediatrics is a lot of very intricate kinds of diseases to talk about and to learn about. I don't know if I would put depression as like one of the first ones on the top of the list. I don't know why you thought about that, but it is an important one. But certainly children with chronic illnesses, we have a lot of preventive measures that we are using that really have kids do really well with diabetes and with asthma. We also also immunize kids against so many things that we really are doing a fantastic job in terms of prevention. Number two, this is the one that I think really gets you. You watch the kids grow up. There is nothing as satisfying as having a patient as an infant and then watching them grow up through their adolescence into adulthood. And I think one of the more satisfying things, even for pediatricians like me, who are in an academic setting, not in a private practice, is you still are able to form solid relationships with your patients. I've been to my patients' weddings. I haven't been to as many graduations as I'd wanted to because they don't get so many tickets to have people go. But one of the highest compliments is I took care of second-generation kids, where I took care of their parents and they grew up and brought their kids to me. I think that's one of the highest kind of endorsements of their trust in you that you could ever have. And so that kind of feeling is really rare except in the area of pediatrics. And I think that's really what gets a lot of us. And then number one of the top 10, what else are you going to do? Go to law school? Okay, so pediatrics of the specialty areas is certainly one that you ought to feel incredibly positive about. All right, so let me share with you now a little bit more about the American Academy of Pediatrics, as I really want to link you into that and have you think of the American Academy of Pediatrics as a resource. First of all, the Academy was founded in 1930, and as you see here in their mission statement, the founding was not about pediatricians, but it was about children. It's about attaining optimal physical, mental, and social health and well-being for all infants, children, adolescents, and young adults. It's about the patients, and the Academy is really well known for that orientation, especially on Capitol Hill. When you go there, for the most part, they know you're coming about an issue that relates to the health of children. You're not coming for something that specifically relates only to, you know, what's the benefit for pediatricians. We advocate for pediatricians, but it is not what our reputation is really solid for. It's about advocating for children and families. There are 62,000 members who are part of the organization, and it's not just pediatricians. I'll show you about residents, fellows, medical students. Also, physician's assistants are now associate members. There are pediatric neonatal nurse practitioners that are a part of the organization, as well as pediatric dentists. We have an oral health section. And so we are more reflective across the spectrum of health professionals who take care of children who are not just pediatricians. And so I think that's an important kind of spectrum that we're talking about now as we look more about teen care for children. It's one of the largest organizations in the world for pediatricians, and certainly the largest in the United States. We have a young membership, 42% are less than 40 years old, and most of the residents who are in pediatrics are members of the American Academy of Pediatrics. When we talk about students, I especially wanted to have this to show you that not only do we have residents that are part of the section on medical students, residents, and fellows in training, but we also have medical students, 1,800, trying to get additional medical students, and also fellowship trainees. And there are a number of benefits to medical student membership, including access to the meetings when they're in the city that you're in at no extra charge. Very often there are publications that you get as part of your membership. So I would really encourage those of you who go into medical school, if you're interested in pediatrics, to join up early to have an opportunity. I think the membership dues are like $10 or something. And even some state chapters sponsor medical students to be members. And so there are there are not too many bargains that you're going to get for membership in anything, and this is really a really good bargain, okay? So, what do the sections do that ought to be of some interest to you? Advocacy, again, is one of the big sort of promotional kinds of activities of the American Academy of Pediatrics. And each year, the section on medical students, residents, and fellows and trainees elect to do advocacy around specific issues. And as you can see over the years, their issues have pretty much parallel what the larger issues are for the Academy. And the one coming up this year is what they call FACE, F-A-C-E, poverty. And that is they're going to have activities that address food insecurity, access to health, community relations, and education. But you can see they've also previously done injury prevention advocacy, especially regarding a response to that Florida legislation that was passed. Are you all aware of that at all? In Florida, they passed legislation that said doctors could not ask patients about guns. Have you ever heard about that? We need to know about, nothing to say about gun injury. Do you store guns at your house? Are they under lock and key? The normal kind of things that you ask patients is now illegal in Florida, okay? Unbelievable. But we did fight that, the Academy did, and it was taken to a higher court, and 2-1, the judges said, you don't have the right to ask about guns when you interview a patient. Okay, so there's lots of advocacy work to do, okay? And we're just peeling off bits of it. All right, so the FACE poverty is consistent with what the agenda is now for the American Academy of Pediatrics. Our newest initiative is on poverty and child health. And there is a work group formed that essentially is guiding the Academy in terms of what its members can do. And you want to say, so why poverty? Poverty, is that a health issue? All right? And let me just suggest to you that when we look at what the determinants of health are, that we see that healthcare really is only responsible for about 10% of what health outcomes are. Now, there is a significant genetic component, another 30%, but over 50% of health outcomes are really determined by behavior, by social factors, and by environment. So understanding more about how poverty really impacts on children and their health, we feel needs to have more attention drawn to it. And so we look first about what research has told us around poverty and child health. And we know that there's increased infant mortality related to poverty, specifically tied to low birth weight and other kinds of perinatal issues, that chronic diseases are often more severe in poor environments, and so poverty is an issue in terms of asthma outcomes, in terms of its relationship to obesity and mental health. That food insecurity, we're starting to ask more about that in practice as one of the medical questions to ask about, in terms of, have you in the past month experienced the situation where there wasn't sufficient food to eat? And some people also link it to issues related to smoking, that very often it's been shown that parents who spend money on cigarettes often don't have money at the end of the month for food for their kids. So trying to understand how some of that works and be able to counsel families appropriately is what the Academy is really focusing on now. Obviously, access to care has always been a concern, especially around preventive care and around primary care for low-income families. Accidental injuries are higher in poverty-stricken families, as well as toxic stress, as you might imagine, in families where there is insufficient income. Now, what is the work group suggesting would be the goals that we would be trying to accomplish as a result of intervening into poverty in terms of pediatrics? So the first thing that we always look at is how to educate our members. And so what we want to do is to make sure pediatricians have competence and confidence, as well as they see a reason for asking about issues related to poverty so that they can see they have the opportunity for referral for interventions, for early Head Start for children, for the WIC program so that people can have, adequate nutrition. And so you should always, we feel, be in the office assessing those kind of things to make sure that your patients are linked to some of the interventions that are available in their communities. There obviously is advocacy and policy issues. We're talking about things like minimum wage laws and what kind of impact that very often may have on families and how we can join in advocacy around those issues. Supporting families in child development, making sure parents know about screen time and the need to really limit, the TV as acting as a babysitter for children. Again, those are very often what low-income families are left with as alternatives, and very often we can link them to community activities that can help them in those areas. And then assuring every child is ready for school. We know early education really makes a difference, especially for low-income families that may not have as many resources within the home to really give their children. So again, these are some of the goals that the Academy has sort of put out there for our members to really be aware of in terms of what they can do in their offices for low-income families. So sometimes when you start in this, people say, well, this is the USA, we're a rich country, all right? So aren't our kids kind of doing well anyway? And I think one of the sobering statistics that even in this day and time, even though it was first sort of uncovered by UNICEF in 2007, was this sort of comparison of the rank of well-developed countries in terms of how their children fare. And what you see here is, for example, material well-being, health and well-being, education, family relationships, and behavior. And we see where the U.S. ranks in these things. Look where we are. Health and well-being being one of the worst kind of ranks that we have, okay? And so I think, sometimes you've got to go back to people and sort of point out this sort of international kind of look at how children are doing before people really believe that we have a case to make in the United States about what we need to do to be much more supportive of children and families. So let me close with a quote that came from this UNICEF study that really emphasizes, how important it is to attend to children. So this is the important quote. A true measure of a nation's standing is how well it attends to its children, their health and safety, their material security, their education, socialization, and their sense of being loved, valued, and included in the families and societies into which they were born. So if I haven't convinced you to go into pediatrics, or you weren't already, hopefully I just stoked you up a little bit more to go moving down the road in that choice, that you'll at least in whatever health arena you're in, think about the impact of what you do on children and families. So I thank you for this opportunity to share this with you, and I hope that it has given you some things to think about as you're planning your career, and I appreciate this opportunity. Thanks so much. Do you guys have any questions or at all? Okay. Yes, ma'am. Okay, so that's a very fair question. How did I decide to go into pediatrics? So as you heard, I trained in Detroit at Wayne State. And as you might imagine, it's a very low-income population, disadvantaged community. And I think you always feel like you want to do something that helps people. I mean, that's why we go into medicine in the first place, right? And the adults that we were helping, it just seemed like it was kind of like a merry-go-round. Like you fix their hypertension, you fix their congestive heart failure, you talk to them about not smoking, and they go back to their environments, and it doesn't happen, you know? They're back again 2 months later or 3 months later with the same kind of symptoms. It seemed, and Wayne State had a children's hospital, that no matter how indigent a family was, they always wanted to do positive things for their kids. And they would go out of their way to do that. They would find the resources to do the positive things for their children. And so I just think I just got in the groove of we're all trying to do the same thing and help kids. You know, I'm trying to help them, and I'm trying to work with the parents to help you, and we're all on this together. And I think pediatrics has that kind of flavor to it. Plus, the pediatricians were nicer than everybody else. Okay. But really, I think it's the hopeful nature of pediatrics that really got me. Okay. Other questions at all? Okay. All right, and I encourage you also to, when you go into whatever field, and especially in pediatrics, to be involved in organizations, okay? Because that's really the most powerful tool you have as a child health advocate to make a difference, which is to be with colleagues who are willing to organize around what these child health issues are, okay? And then have a group like the Academy. The Academy has a Washington office where they have like 12 people who do nothing but advocacy on Capitol Hill, okay? I mean, it's hard to get that. All right? And then in each state, there are chapters that have people who also advocate for children's issues, who do an immense amount of good work for children in individual states. And so I would encourage you, if you haven't connected with the state chapter, and California has like 3 or 4 state chapters. They're all divided into the area, geographical areas. And I would be happy if you're interested in you know, knowing more about those chapters to get the information for the organization so that you can connect up a little bit, okay? Because I think that would be encouraging. All right? But again, I'm going to be around for lunch. If anybody has any other questions, I'd be happy to answer them. Okay, thank you.